How do doctors interpret mammogram calcifications? Have you ever wondered how doctors make sense of those tiny white spots on a mammogram? These spots, known as calcifications, can tell a lot about breast health. Let's break down how doctors interpret these calcifications and what they mean for you. Calcifications are small deposits of calcium in breast tissue. They show up as white spots or flecks on mammograms. While they are common and usually harmless, certain patterns can indicate potential issues. First, doctors classify calcifications based on their appearance. There are two main types: macrocalcifications and microcalcifications. Macrocalcifications are larger and appear as big white dots. They are almost always benign, meaning they are not cancerous and typically do not require further testing. On the other hand, microcalcifications are tiny and can vary in shape and size. Their pattern is key in assessing whether they might be a cause for concern. Next, doctors look closely at the morphology, or shape and size, of the calcifications. If they are uniform, round, and scattered throughout the breast, they are likely benign. However, if they are irregular, vary in shape and size, or have fine linear or branching patterns, they may raise suspicion. These irregular patterns can be associated with conditions like ductal carcinoma in situ, which is a non-invasive form of breast cancer. The distribution pattern of the calcifications also plays a role in interpretation. Benign calcifications often appear in multiple areas of the breast. In contrast, suspicious calcifications tend to cluster closely together or follow a specific pattern that resembles breast ducts. To help with this assessment, doctors often use a standardized system called the Breast Imaging Reporting and Data System. This system categorizes calcifications from benign findings to those that are highly suspicious for malignancy. For instance, fine pleomorphic calcifications in a segmental distribution might be classified as needing further investigation. If calcifications appear suspicious, doctors may order additional imaging. This could include magnification mammogram views to get a clearer look. Sometimes, breast ultrasound or magnetic resonance imaging may also be used for further evaluation. If there is still uncertainty, a biopsy may be recommended. This procedure involves taking a tissue sample to determine whether the calcifications are benign changes, precancerous lesions, or cancer. Understanding how doctors interpret mammogram calcifications is important. Early detection of suspicious calcifications can lead to timely diagnosis and treatment. While many calcifications are harmless, those that are suspicious require careful follow-up. Regular mammograms allow doctors to monitor any changes over time, helping to manage breast health effectively. In summary, doctors interpret mammogram calcifications by examining their appearance, shape, and distribution. They use classification systems and may recommend further imaging or biopsy if needed. This careful approach helps distinguish harmless calcifications from those that may signal early breast cancer, supporting timely intervention and better outcomes for patients.